take off your socks here, because we're going to need to have those off for your foot evaluation. Okay.
You're recording.
I know. That's right. Hi, Anne. My name's Victoria.
Hi.
I'm going to be your provider today. Do you have any medical complaints right now?
No.
Okay. So what we're going to do today is an in-depth musculoskeletal exam. I am recording this, and it will be uploaded to YouTube. Only my professor will see it. Do I have your permission to continue? Okay. So when doing an in-depth musculoskeletal exam, you can take your watch off too, because we're going to assess your wrist. Sorry. When doing an in-depth musculoskeletal exam, it's really good to do it systematic. So today we're going to start with your hands. We're going to move on to your wrists, your elbows, your shoulders. We're going to do your neck and face, and then I'm going to go ahead and do your lower extremity, and we'll do your spine first. Okay, if at any point you have any questions, please let me know. When we're doing palpation of your joints and range of motion, it's really important to tell me if you have any kind of tenderness. Okay, starting with the hands. So the first thing that you want to do is look at the color. You want to look to make sure that they're symmetrical. We're looking for any kind of gross deformity to the fingers, any kind of symptoms of trauma, any swelling, redness that would indicate any joint infection, and again, looking to make sure that they look symmetrical, which they do. Moving on, we're going to palpate. Everything we do, we're going to do bilaterally. When palpating, we're going to palpate the phalanges all the way down. We're going to do the distal and the proximal joints on each hand. We're doing this to see if we elicit any kind of pain. If we do have any pain or tenderness in the joints, that would be indicative of an osteo or rheumatoid arthritis, but most likely in someone young and healthy, you're not going to have anything. Do you have any pain when I do that? Okay. After palpation, we are going to move on to range of motion. So the range of motion of your fingers is we are going to flex, extend down. Then we're going to be doing abduction and adduction. So we're going to abduct away, and we're going to adduct in. Okay? Moving on to your wrists. Again, we are looking and inspecting. We're looking bilaterally to make sure that they are equal and doesn't have any major asymmetry. We're looking for any bony prominences, any swelling, any signs of trauma, and then we are going to palpate after that. We are going to palpate the radial ulnar head all the way around, looking for any kind of tenderness. Do that bilaterally. Perfect. Does that cause any pain? Okay. So next thing we're going to do is range of motion of the wrist, and just like the hands, what we're going to do is we are going to flex, we're going to extend, we're going to abduct, and we're going to adduct. Perfect. No pain when that happens? All right, moving on to the elbows. When inspecting the elbows, again, same thing. We're going to be looking for any deformity, any redness, any swelling. We are going to look for symmetry bilaterally, anything that would indicate any kind of trauma. And then we're going to palpate. We are going to find the olecranon process, and we are going to palpate that area. Then we are going to do the medial, sorry, the medial epicondyle and the lateral epicondyle. So if you have tenderness in these areas right here, that could be a sign of baseball sign, golfers, or tennis elbow. Again, the olecranon process, finding that, and then palpating the medial olecranon and the lateral olecranon. Okay, range of motion of the elbows. Extension, flexion. Come on out, and we are going to do pronation and supination. Okay, pretty easy. That's the easy one to do. Now moving on to the shoulders, which is one of, let me back up just a little bit. I forgot on the wrist, a couple specialty tests that we need to do. One of the most common things that people with complaining of wrist pain come to the clinic for is for carpal tunnel syndrome. So the Tennell's test, I'm going to go ahead and hyperextend the wrist, and this radial ulnar nerve runs right down the middle. So I'm going to percuss that. If that's a positive sign, you're going to have pain and numbness that run down your hand into your fingers. Do you have anything there? Mm-hmm. Okay. Same thing here. Hyperextending the wrist. Any pain? Okay. One more is the balance test. Upside down prayer. Go ahead and push those wrists together. You're theoretically going to hold this for a whole 30 seconds and see if that elicits any kind of pain down the hand or into the fingers. And then we're going to reverse it and do the upright prayer and pushing your wrists again together. A positive test for this would be if you, again, had numbness and tingling that went up. All right, moving on to the shoulder. First of all, you're going to look at posture, you're going to look at symmetry, you're going to make sure that your shoulder level is equal and normal. Looking for any redness, any swelling, any kind of indication of trauma. If like her arm was hanging down, I would suspect maybe a shoulder dislocation. But just looking to make sure everything looks okay, which it does. So then we're going to move on to palpation. We're going to find your suprasternal notch, and then I'm going to walk my fingers palpating out laterally along the clavicle until I find the acromion, which is a little bone here at the top. And then if I move medially, just a little bit, I'm going to find what they call the acromion AC joint. Acromion, just look it up. I always forget. Clavicular. The acromion clavicular joint. Once that's found, I'm going to go ahead and come down here to the delta pectoral groove, and this is where I'm going to find the crinoid process, and perfect. Then I'm going to laterally come out, and I will then be able to locate my lesser tubercle and out to my greater tubercle. Same thing on this side. I'm not sure you'll be able to see me palpating out. Find the acromion, looking for the acromioclavicular joint right here. Palpating down to the delta pectoral groove. Lateral movement over here to the lesser and the greater tuberosity. Perfect. After palpation, we're going to move on to range of motion. So range of motion of the shoulder, the first thing we're going to do is we're going to flex up. Let's do that on both sides. Extending back approximately 60 degrees. Perfect. Then we are going to do abduction, and then abduction, we're going to bring one arm across the front, and then the other arm across the front. So let's do internal rotation, your arm behind your back on both sides, and then external rotation, let's go behind on both sides. Perfect. Any problems there? Okay, so some special tests that we can do. This one's called Speeds test. So go ahead and put your palms up. I'm going to press down. I want you to resist. Perfect. If this creates pain in here, that could be a labral tear in the shoulder, or it could be a bicipital tendonitis that you have in there. But that didn't cause you any pain, correct? Okay. Moving on from the shoulders, we're going to go up and do the head and neck. So starting with the head, let's start with the jaw because I tend to forget it. First thing I want you to do is I'm going to palpate here, open and close. Good. I'm feeling for any clicking. So for range of motion of your jaw, what I want you to do is open your mouth, and I want you to stack 3 fingers and fit them in there. Perfect. That means you have good range of motion of your jaw. Now while your mouth's open, I want you to do your jaw back and forth, back and forth. Perfect. So moving on to your neck, again, I am going to inspect. I'm looking at your trachea, making sure there's no deviation. I'm looking at muscle tone, make sure there's no muscle atrophy, no redness, no signs of trauma, anything like that. When I'm palpating, maybe turn the camera a little bit, I'm going to palpate the cervical. I'm going to come down here and make sure I palpate the trapezius muscles, and just feel all this area to see if we elicit any kind of tenderness. Anything there? No? All right, so let's move on to the range of motion of your neck. So first of all, flexion, chin to the chest, extension, side to side, and then let's do lateral bends, your ear to your shoulder on both of those. Or you can just have the patient do a big turn of the neck, and that usually gets all of that going. So one of the things, if you're having any suspected nerve root problems, one special test that I can do for your neck is to have you, say this side's affected, I'm going to go ahead and have you extend a little bit, turn towards that side, and I'm going to put some downward pressure on your neck, and that should elicit pain to indicate some kind of radiculopathy. Otherwise, big concern with that, if there's known disease or they're really elderly, it's probably not a good idea to do that test. So at this point, I'm going to go ahead and have you lay down. We are going to start from the bottom up. Make sure I have you on camera there. Okay, so starting with the feet. Again, again, like everything, inspection, I'm looking for any corns, any bunions, any kind of deformities, any calluses. I'm going to look at all your toes to make sure that there's no bony prominences or anything like that. And then I'm going to go ahead and check both sides here, and I'm going to start palpating. When I'm palpating again, I'm going to feel all the metacarpals, and I'm going to be doing the distal and proximal joints to see if I elicit any kind of tenderness when I do that. There is a Morton's neuroma, which is a common foot problem, which is tissue that builds up around the nerves that go in between the toes. So what I'm going to do is I'm going to make sure I press down and palpate in between all your toes to see if I feel any kind of lump or if that elicits any kind of sharp pain. Doesn't seem to be. So palpating all your bones here as well. Don't seem to have any pain there. So now we're going to move on to range of motion. So I'm going to have you curl your toes. Perfect. And then flex your toes up. Perfect. And then for the foot, what I want you to do is an inversion and then an exversion. Perfect. So moving on to the ankle, first thing we're going to do, obviously, is to inspect. We're looking for redness, any swelling, any gross deformities, any kind of unequal in each side. Make sure everything looks symmetrical on both the feet and the ankles. I'm going to feel your tibial and malleolus on both sides, palpating, and I'm also going to palpate up your Achilles tendons. I'm going to do that on both sides just to make sure that we don't have any pain or tenderness. Perfect. So on the ankle, let's do a dorsal flexion, so passive and then active range of motion on these. So go ahead and do that on your own. Perfect. And then I'm going to have you abduct and adduct. Perfect. All right. So moving up to the knees, first thing I'm going to do is do a visualization of the knees, making sure that they're symmetrical, that there's no redness, that there's no fluid that would indicate a bursitis or anything, no trauma, everything looks good there. Moving on, after we do inspection, we're going to palpate the knees. So your patellar groove is right here. Find the patella, and we're going to feel for the patella groove. And here on the sides is your medial, it's coming to me, medial lateral meniscal grooves. All right, so right here is your medial meniscal groove and your lateral meniscal groove. You're going to want to palpate those on both sides bilaterally to make sure that we don't elicit any tenderness. If there is tenderness, we may have to go in and think about some possible meniscal tear or injury, which we can do more tests in the future for that. So for range of motion of the knee, can you sit up? Just sit on the edge. So range of motion of the knee, we're going to do passive flexion, extension, and then we're going to have the patient do active, passive, or active extension and flexion. Good. All right, go ahead and lay back down. Sitting up, I should have had you do passive adduction, or adduction and passive abduction on both sides when you're sitting up. But we're also going to test those here. So the first specialty test that I want to do on your knees is what we call a valgus and varus maneuver to test for your meniscal and to see if there's any kind of meniscal injury or tear. So valgus is medial, so to do a medial test, what I'm going to want to do is I'm going to place my hand on the lateral portion of your knee, and then I'm going to grab your foot and I'm going to do a passive abduction of your foot to put pressure on the medial meniscal area. And the reverse of that for the vagus is to put my hand on the medial side, so this is now going to put pressure on the lateral point, and I'm going to bring your lower extremity and I'm going to do passive adduction. So same thing on the other side. For the vagus, to test the lateral, we are going to hold here and do adduction to put pressure on the lateral meniscus. Reverse side for the valgus, putting pressure this way. Okay, perfect. Another specialty test is Langen's test, which is more for an ACL tear. This one I have a hard time doing. but we're going to grab the leg and we're going to physically take the lower leg, the tibia and fibia, and physically try and move it up and down. What we're looking for is laxity, which would indicate that the anterior cruciate ligament is loose or has been torn. So doing that on both sides, you would want to compare both sides anyways. The other specialty test for an ACL is what we call the drawer test. So we're going to bring the patient's foot up, we're going to sit on their foot so we stabilize the tibia and fibia, and we're going to open and close the drawer. So this is for your posterior anterior cruciate ligaments. Again, looking for laxity that would indicate any kind of tear or injury. And repeating that on this side, drawer test. Perfect. All right, everything feels good there. The last test for the knee that we are going to do is what we call the Murphy's test. So this one, what we're going to do is we're going to put pressure on the lateral area. We're going to bend the knee up, and when we straighten it out, we're going to be feeling for any popping or clicking or any slipping. Does that cause any pain? All right. We would do that bilaterally to compare. All right. Perfect. All right. So we've done that. Now we're going to go ahead and move up to the hips. So the first thing when we're looking at the hips is we're going to do inspection. So we're going to be looking for redness, swelling, any kind of deformities. If there's a shortening and rotation, we can suspect a possible dislocation or a fracture, but we want to just make sure everything looks good. So we're going to start our palpation from the front. We're going to be looking for the anterior superior iliac spine. Sorry, I don't mean to tickle you. So I'm going to locate that. Okay, perfect. And at this point, I'm going to have the patient roll over onto their side. Which side? Roll that way. We're going to end up making a big turn. And I'm going to find the, just straight here, the greater tuberosity. I'm going to palpate there. It's the large bone there. And then I'm going to find the posterior iliac superior spine, which is back here. It's kind of our, what we call our butt bones, where we sit. And right in this area, it's good to know that the sciatic nerve runs right in between there. We are also going to locate the sacroiliac joint, and that's basically that little dimpling. They have two, they're just off the spine. You can see it on some people where they get that dimple, but that's that point that you're looking for. So while I have you in this position, we're going to go ahead and test this extremity for its range of motion. I'm going to do the abduction, so I'm going to have you bring this leg up. We'll do passive and then active. Perfect. Go ahead and roll onto your stomach now. From this area, we're going to test her extension of hips, so I'm going to passively try to extend. And then I'm going to go ahead and actively have the patient do an extension. So go ahead and raise your legs. Oh, good, you can do them both at the same time. That's impressive. All right, so rolling on to your other side now. Same thing. We're going to palpate all this area, find the greater tuberosity. Test your abduction there. Perfect. Now, go ahead and roll on your stomach. Oh, I'm sorry, your back. You're doing a fine job. We're going to finish testing the range of motion. So passively, we're going to do flexion.
Nurse practitioner,
Flexion.
Lee, 847.
Perfect. And go ahead now and do active
Nurse
flexion.
practitioner, John Lee,
Perfect.
847.
Perfect. And the last one we're going to do is adduction of the hip, because it does rotate. So I want you to just passively or actively bring it over, just like I did. Perfect. And again with the other side. Perfect. So some specialty tests that you can do for the hips. Are you in pain? Are your legs hurting? Or what's going on here? I'm going to have you put this. Can you do this? Can you put this leg right here?
Kind of.
Okay, so I'm going to press on this side.
Okay.
And I'm going to press down, and that if that creates pain, that can be an indication of some kind of hip problems. So the other test that we can do is what we call a Thomas test. So to do the Thomas test, I want you to take your legs and pull this up as far as you can.
This?
No. Grab your.
You want me to hold it?
Yeah, grab it and pull it down. This is going to go ahead and flatten up the back. If this causes any kind of pain, it can be some kind of a sign of some hip damage or even some lower back problems.
Okay.
Go ahead with this. Same thing. Does that cause some pain? You have a history of a labral tear, so I don't want to do it too hard.
No, it's just tight.
So
No pain.
bend this up too and do the same thing there. This is flattening out your back. If this leg comes up, that's a positive. That's a normal sign. Positive would be that elicits some kind of pain. So at this point, we're done with the hips, and we're going to move on to the spine. So to do the spine, I'm going to go ahead and have you stand up. And while I'm standing up,
Can I put my shoes on?
yeah, I'm going to check one thing really quick. While I'm standing up, this is where I'm going to actually check your feet for flat feet. So if you'll just stand up once really quick. You'll be all right. And she's got a good normal arch there. There's no flat feet. Do you want to put on your shoes? Okay, perfect. Let me make sure I can see you. Let's rotate you. There. Okay, so anytime we are doing the spine, of course, we are first going to inspect. We're looking for a natural curvature. We're looking for a straight, normal spine that runs all the way down. We're looking to see if there's any kind of trauma, any abnormalities, and I don't see anything. The spine, we're always looking for a good S-curve. It should be concave, then become convex, concave, and then convex again. And all of that looks good on her. You're also going to want to inspect the spine from the back on both sides to make sure that there's no kyphosis or anything like that. Perfect. And while inspecting the spine, go ahead. I'm going to have you bend forward, touch your toes, or go down as far as you can. And you can stay standing. Just bend. This is where you're going to look for any signs of scoliosis. We're going to want to make sure that that is all normal there. So moving on, after we've done inspection, we're going to go ahead and do palpation of the spine. So we're going to start here at C7, which is the most prominent bone. And we're just going to walk our way down and feel all of the vertebrae and the spaces. Making sure we don't feel any step-offs, any lumps, anything, or if any of that causes pain. So we're also going to feel all the muscles next to the spine and make sure that they are not spasming or having any kind of issues there. During this, we're also going to percuss down the spine, see if that elicits any kind of pain. Do you have any problems there? No? Also feeling all these trapezius muscles and rhaboids and everything else that connects to the spine. So everything looks really good there. So now we're going to do range of motion of the spine. So flexion, that's your rotation. Extension, go ahead and flex forward. And let's do some lateral bends. That's spinal rotation, good. Lateral bends, and do a full spinal rotation for me one more time. Rotation. Good. Good. Everything looks good there. And at this point, I think we're done with our musculoskeletal exam. Thank you, Anne, for your help.